Megan Fox.
Yeah, Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox writes at PJ Media.
Eat Tucker.
And that was your last.
Damn it, man. I cried for 2 days.
Megan, thank you very much for that.
So, I can explain the bed thing.
If you don't show up and vote, up your ass. I don't care if you're in the hospital. Crawl to the stake. Crawl there.
It's like Jesus going to the temple. He's like, I got a whip. Get out! Get out! The lovely and wonderful Megan Fox. Not that one.
Not that one. Not the weird one that drinks blood in his toe thumb.
Megan Fox.
Megan. And honestly, Megan, if you don't like it, I'm sorry.
She's the devil.
Megan.
Megan Fox.
Megan.
Megan Fox.
I've been very nice to you, although I could probably maybe not be based on the way you have treated me, but I wouldn't do that.
You've never met a like me. You want to tangle? You want to go? Holy sh!
Too much cussing on this. I guess we didn't bleep it, so we got to turn it off. But it's
You pissed off the wrong woman.
oh my God, I have been assaulted when Megan Fox runs wild on you, brother.
She's the devil.
Not for publication.
The story.
I'm Megan.
Megan.
Megan Fox. Thank you. Cheers.
Hey there, everybody. Welcome back. It is the Megan Fox Show. And I've decided I was just about to watch the opening statements. I was actually just watching it on my phone. Rachel Bruno, my good friend who has been through something similar as this family, texted me and said, "Are you watching this trial?" And I was like, "No, what trial?" And I turned it on and I realized that I need to be watching this with you. So that's what we're going to do. Now, I don't know how long I don't know how long I have because I do have to go to work in a couple hours and I've got paperwork here I need to do for the tax man. I'll be recording my tips and stuff for the IRS while we watch this together. But it is really interesting to me because I have covered several cases where CPS, with the help of hospitals, have medically kidnapped children and have violated the constitutional rights of parents, destroyed families. I mean, Cynthia Abzug to Rachel Bruno, and Rachel Bruno came out on top, but they really could have destroyed her entire family. Now, let's give a quick recap of what this story is about, and then we're going to get right into opening statements, which happened earlier today. I think it was earlier today. So this is going to be on replay, which is great because we can speed it up and we can skip past the boring parts and just get to what matters. Man, I'm all breaking out in hives. Just ignore the redness here. I don't know what's going on. But anyway, let's look at an article about this case so I can give you a quick rundown about what the background is. I can see that StreamYard is already screwing with my camera, which really bothers me. If you see camera lag, if it keeps getting worse, I'll just end up turning off my camera and we will just have the other screen on. But hold on, let's get an article up here to give us a recap about what what is happening here, and then we're going to go straight into it. All right, I'm reading from something called Collider. Oh, God, now I got to turn off my ad blocker. How? How do I do that? I don't even know how. Let me just archive it. That's so much easier. I really hate it when websites make you turn off your ad blocker. Let me just tell you out there, websites. If you make me turn off my ad blocker, I'm just going to archive your story. I'm just going to get around it because I don't have time for that. Ain't nobody got time for that. Anyway, guys, have you hit the like button? Have you subscribed? We are on live right now on YouTube, Locals, Rumble, and I probably will turn off YouTube in a little while because YouTube is asshole. Repeat with me. YouTube is asshole. All right, let me share this article with you. Let's get this up on the screen. Make sure you hit that like button and share with your friends. All right. Hello, chat. It's good to see you all. All right, let's look at this. Now, there is a documentary on Netflix. I'm considering not watching the documentary until I watch the trial because I do not like the way that documentaries will skew your the way you think about the story before you see a trial and what's admissible as evidence in court. But we'll see. All right. Robin Noel says, "Oh, I only have YouTube." No, you don't. You also have Rumble. You go to www.rumble.com. I will drop the link where I am streaming on Rumble, and you can get right over there. You can download the app on your phone. You can pull me up right there. You can get it on a browser. You do have Rumble. If you have the internet, you have Rumble, and you can go over there and support the only free speech platform besides Locals that exists. And you can go to Locals too, because guess what? There's an app and it's on your browser. So please don't give me excuses that you don't have it, because you do. And you can download an app today on your phone. Just go to the App Store, download Rumble, download Locals, and follow me at those places, because YouTube is going to erase us all. And if you support free speech, you need to support free speech platforms. The links are in the chat, you guys, on YouTube. Please go there. Hello, Locals. You are my ride or die. I'm feeling so much better. Prednisone is a miracle drug, and I am on it for 3 days or 2 days, and I already feel like a different person. All right. Great. Robin, I'm so glad that I taught you something today. That's terrific. So you do need to support those platforms, though. So get on over there and do that. Now, YouTube has totally demonetized me completely and totally. So if you're trying to send me a super chat, you're going to realize that you can't do it. But I have a way around that. And it's great because I get 100% of the proceeds instead of, 30% or whatever it is that they used to give you. So scrolling across the bottom of your screen right now is a way to send a tip. You can send it on Cash App at Not That Megan Fox, or on Venmo at Megan Fox, Megan-Fox-89. It's scrolling across the bottom of your screen. So if you like the show and you want to support me, that's the way to do it. If you're on Rumble, you can send rants for pants. I still need pants. Everybody needs pants. Rants for stoves, all the things that I burned down, rants for pants. And if you're on Locals, you can send tips there as well. You can also join me at meganfox.locals.com, and that supports the show as well. All right, let's get into it. We're getting into it, and then we're getting straight to the comments. And not the comments, the opening statements. If we don't get through all of them today, it's okay. This is part 1. We will do part 2 tomorrow morning. All right. The true story behind Netflix's Take Care of Maya is beyond heartbreaking. A story that shows the true horrors behind taking your child to the hospital. You all know I've been railing about this for years about these doctors and what they can do and the power that they have to destroy your life and accuse you of Munchausen and all sorts of terrible things. And this family, I don't know why they're not suing the state. They really need to be. They're only suing the hospital. All right. Even though we are discouraged, we will not settle. The words by Maya Kowalski capture the emotional struggle of the Kowalskis and many other families who have found themselves being targeted by the system. Henry Roosevelt's Take Care of Maya on Netflix feels like an ode to this struggle by the time the curtain falls on the story of Maya Kowalski and her family. The Netflix documentary doesn't waste much time getting to the crux of the problem. To accurately highlight the magnitude of the tragedy that followed, Take Care of Maya starts out by shedding light on the life of the family before it struck. But even with the slightly hopeful beginning, it becomes evident that there is a limited light at the end of the tunnel as the truth behind the tragic events faced by Maya and her family is laid out for scrutiny. But what what is the true story behind this documentary? By the time 17-year-old Maya Kowalski gets done with her story, it becomes evident that as opposed to the many Netflix documentaries in which the perpetrators are numbered and few, there are many responsible for the systemic violence dispensed out in Maya's case. The more haunting reality with which even Henry Roosevelt decided to conclude his documentary film is that the victims of this violence also lie in the hundreds. I think it's more than that. Though a shocking true story, Take Care of Maya bears down a problem much rampant and larger than what could be captured in a nearly 2-hour documentary film. Maya's story began when she was born to Jack and Beata Kowalski, who faced initial difficulties conceiving a child. All right, I'm going to skip through some of this because I can't. We need to get going. Life was going well until Maya started feeling sick with symptoms ranging from blurred vision to unbearable pain. After going through an array of doctors who failed to identify the cause of Maya's condition, an expert in complex regional pain syndrome, Dr. Anthony Kirkpatrick diagnosed Maya with the disease and started suggesting a ketamine infusion treatment, which delivered proven results to many patients before Maya. A patient suffering from CRPS goes through spontaneous bouts of excessive pain, much greater than a normal pain. Even a small touch may lead to feeling immense pain. Thankfully, the ketamine infusion worked for Maya and she got significantly better, although she wasn't able to walk still. Maya's condition required her to be under high dosages of ketamine. When the Kowalskis couldn't afford Dr. Kirkpatrick's treatment anymore, they were referred to Dr. Ashraf Hanna, who continued to prescribe low dosages of the medicine. The situation was fine up until an unfortunate day in October 2016 when luck ran out for the family. On October 7th, 2016, Maya relapsed and her parents took her to Johns Hopkins All Children's Hospital after she complained of suffering from stomach pain. Jack quickly found out that the doctors at the hospital had little idea of Maya's condition, and he made them talk to Beata, who insisted on ketamine infusion in high dosages. This seemed to have triggered the suspicions of the doctors regarding child abuse, which quickly cemented once they noticed the low-dosage ketamine infusion was having little effort on Maya's condition. As a result, the doctors reported the incident to the Child Protective Services, leading to the entry of child abuse pediatrician Dr. Sally Smith. These are the worst people on earth, by the way. Dr. Smith quickly concluded, apparently after a 10-minute interview with Jack, that Maya was to be taken into state custody. Dr. Smith strongly believed that Maya was a victim of medical abuse. This is what they accused Cynthia Absug of, by the way, medical abuse. And Beata was diagnosed with Munchausen syndrome by proxy. You cannot even be diagnosed. It pisses me off. You cannot diagnose someone with this. You literally, in order to do that, have to rule out every other diagnosis. And I can't wait to see if it comes in how she was diagnosed, because it is such a quack. It's a quack theory to begin with. Oh. The conclusion by Dr. Smith, who does not appear in the documentary, but I bet they'll put her on the stand or him, resulted in Maya's custody being taken away from the Kowalskis. Interestingly, in the documentary, Dr. Kirkpatrick reveals that he had offered objective evidence regarding Maya's diagnosis to Dr. Smith, but she did not mention the same in her report. That's called leaving out exculpatory evidence. That's what that is. Oh, God, I hope this doctor is being sued. The hospital prevented any contact between Maya and her mother. Later, a psychological evaluation was ordered for Beata, and it revealed that she did not suffer from Munchausen syndrome by proxy. Oh, well, what do you know? What do you know? Hit that like button, please, guys. Hit the like button on Rumble, hit it on YouTube, help the algorithm, and subscribe. In Take Care of Maya, Jack becomes the primary narrator. Oh, we don't care about that. Let's continue. So anyway, despite the continued struggle the family has been through, the worst was yet to come for Maya and her family, as 3 months after Maya was placed under the state custody, Beata Kowalski hung herself in her house. This is so sad. The breaking point for Beata came when she was prevented by the judge from hugging her daughter in court earlier that day. Before committing suicide, Beata sent an email to her family explicitly mentioning the factors leading to her decision. In the email, she blamed the judge should anything were to happen to Maya. 5 days after Beata's death, Maya's custody was handed over to her father, Jack Kowalski. The return home however, was just the beginning of another endless struggle for the Kowalskis. The court denied Maya from taking ketamine treatment. Physical therapy eventually helped her regain her ability to walk, but nothing could bring her mother back. This is so sick, you guys. It's so sick. All right, let's get to it because that's what this is about. She is suing the hospital. I do not know why they're not suing the state because they have a great case against the state, but I can't tell you why they're not doing it. Let me get over to, we're going to go to opening statements now, and I'm going to do my paperwork while we watch and listen to this. I have it on 1.25 speed, so we don't have, so we can get through it a little quicker. I'm going to back up a little bit because I started watching it maybe a minute or two ago. So let's back up just a little. Oh, shoot, I went too far. All right, let's start here.
Plaintiffs will prove that from July 7th, 2015 through January 13th, 2017, Johns Hopkins missed a diagnosis of complex regional pain syndrome on 7 different occasions when Maya was in for their care. We will prove that they misdiagnosed Maya's symptoms from October 7th through the end of the year, wrongfully accusing Beata and Jack Kowalski of child abuse, and alleging and attempting to show that Maya had a mental disorder, that she was crazy. She was making it up. We'll prove that they realized their error pretty quickly, and instead of apologizing, saying we're sorry,
they're already objecting. Already objecting in the middle of his opening statements. That is so rude. God, it's rude. Just horribly rude. All right, so I don't know how long this is going to go on. Let's see. Let's speed it up a little bit. All right, let's go back to, here we go.
upon realizing their error, for the next 3.5 months, they took every step in the world to attempt to force the Kowalskis to agree with the wrongful diagnosis. Maya Kowalski was falsely imprisoned and battered. She was denied communication with her family. She was denied communication with the outside. She was told that her mother was crazy. She was told by social workers that one in particular, she would be her mother. She was put into a room and left for 42 hours with the commode just out of reach because the hospital wanted to prove that she could actually get up and walk. So they wanted her.
Oh my
on
God.
video. This is a surveillance room, to get out of bed.
That's torture.
Go over to the commode when nobody was watching.
So they tortured her.
On herself. For 42 hours, she was kept in that room, denied access to anyone or anything, under the false assertion that it was an EEG exam. Maya was repeatedly battered by nurses and social workers who were trying to prove that she did not have CRPS. Things were done such as coming in and patting her on her leg. They were hugging her against her will, took her down to the chapel, sat her on the lap of one named Kathy Beatty, who told her that she would be her mother. Her mother was, crazy. And that she needed a mother, and that social worker would be there. Maya was kept from her family and friends. She was denied access to her priest. She had what they called religious artifacts, such as holy water, her prayer book, her rosaries taken from her on the belief that her mother was controlling her over religion. She was denied access to counsel, at least insofar as having the ability to actually meet with her attorney without people listening in at the door. All of her phone calls were monitored. Her iPad, computer were taken away because she was told she might be, this is a 10-year-old, cruising internet sex sites. Maya was denied the comforts of her friends and her family throughout her stay there. On another occasion, again, to try to show that Maya did not have rather significant symptoms of CRPS, which you'll see are these small little red, angry lesions that appear on different parts of the body, underneath the arm, along the arms, sometimes on the legs, sometimes on the back. And you'll see photos here in a moment. But in order to prove that she didn't have one, she was systematically stripped and photographed against her will and without any authorization from anyone, least of all her parents. They continued to accuse the Kowalskis, Jack and Beata, of being child abusers, even after the evidence, we believe you'll conclude, was overwhelming that she had CRPS. In fact, we will see whether at some point they even admit she has CRPS in this case. Yet they still, throughout this period of time, continue to accuse Beata of child abuse and Jack of child abuse, something called Munchausen by proxy, which means that you're intentionally trying to keep your child ill. It's usually a circumstance with a very small child where a mother will be like putting something in an IV or things like that. And Maya at this time was 10 years old. There is no evidence whatsoever of Munchausen by proxy. By January 13th, when Maya was finally left out of the hospital, unsurprisingly, this family was a wreck. Maya was not let out of the hospital even after her mother committed suicide on January 7th of 2017. Now, the story with Beata Kowalski is a complex one, and I'll tell you about it in a moment. But we will prove that the continued allegations that she was crazy and she was trying to harm her own children, both Kyle and Maya, and the knowledge of the systematic abuse of her child in the hospital caused her at the end to lose completely and utterly her ability to control the maternal instinct, and that outweighed the survival instinct. In the process, they caused Beata Kowalski her life, denied Jack a loving wife, denied both Kyle and Maya a loving, caring, and amazing mother. They caused just terrific and permanent psychological injury, as one may expect, a permanent aggravation, and we'll explain the medicine behind that, of the CRPS. Now, the CRPS didn't start with Johns Hopkins. It started about 3 or 4 days before Johns Hopkins. But the evidence will show that something that could have been a controllable, manageable disease was aggravated to the point where throughout periods in her life, she will be incapacitated. And through all of it, she and her brother and her father will have post-traumatic issues and problems that will, frankly, we'll get that into that in a moment. We've asked in this case for you to consider not only compensatory damages to try to make them whole for these terrible things that have happened to them, but also punitive damages to deter them, to punish them, and to deter this type of behavior in the future. So some of the evidence here will be directed towards that. So that's the overview of what we're trying to do. Now, how are we going to do it? First, you understand that we have really 4 plaintiffs here. We have Maya Kowalski right here. We have Kyle Kowalski, and we have Jack Kowalski. And Jack's also the parent and guardian of both of them, right? So the claims go through him. And then he has independent actions himself. And he's also appearing for the estate of his deceased wife, Beata. And each of them have causes of action, some of them combined. Now, this historic case has been going on. It was filed in October 2018. I tell you this because the key facts of the case began several years before. But through the course of time, we've taken an immense number of depositions. We have found audio tapes, videotapes, surveillance tapes, a lot of evidence for you to review towards proving these allegations. The core claims, again, are medical malpractice, which is that the defendants failed to meet the standard of care, and we will prove that through expert witnesses, that they failed to identify CRPS, which is also known, by the way, as RSD, the older name, reflex sympathetic dystrophy, now known as CRPS. Okay? They failed to identify it at first, and then they misdiagnosed it. And then once misdiagnosing it and realizing they misdiagnosed it, the evidence will prove they went about a system to try to get the Kowalskis to admit they were right. Battery, I talked about. False imprisonment of Maya on multiple occasions. Intentional infliction of emotional distress is where you do things so outrageous that they cause damage and injury to a person. In this case, a suicide. In this case, traumatic disorders, depression, a multitude of emotional problems and issues. We've alleged fraud in that they intentionally deceived or attempted to deceive in the proof of the matter. We also alleged fraud in that they billed $536,000 for the treatment of CRPS, and yet never treated her for CRPS, and took multiple positions, especially to them, especially to Maya, that she did not have CRPS. Yet they billed over $500,000 to the healthcare provider and Kowalski's for the treatment of it. Beata Kowalski was born in 1973 in communist Poland. You may recall that the Berlin Wall came down in 1988, and in 1990, within a couple of years, she was able to escape Poland at the age of 17 and come to the United States. She also had a couple of relatives here already. So she made it over, stayed with relatives in Chicago, and got her AA in nursing, and then her BS in nursing, and then added to it 2 or 3 other specializations. And then eventually, and we'll go to this in a moment, ended up an infusion nurse. Jack Kowalski was born in 1961. At the time all this went down, so Maya, Beata would have been 44 and would have been 50 today. Jack is 62 at this point. Jack was born and raised in Chicago. He was a firefighter and paramedic for over 28 years, rose to deputy chief, one of the Chicago fire departments. He donated time during the post 9/11 recovery to help. He also did work during Hurricane Katrina during the recovery effort. And we'll have some video, I think, about several saves Jack made, one in rather dramatic of a wall collapsing right after he got some people out of the building. For 9/11, he designed a license plate for 9/11 firefighters, the loss, that's, I think, still in use. And he insists on distilling what he further insists on calling wine, which you will not have to try through the course of this case. That was a joke. Well, I'm sorry. It's just not. So Jack and Beata met in Chicago, and they were married on a cruise in Jamaica in 2004 with friends. Beata became stepmother to Jack's daughter Corinne by prior marriage. They were married, like I say, in 2004. They got along tremendously. There was a lot of mutual interest. One of them scuba diving. Jack was, as we say, a firefighter. Beata was a well-trained nurse working for Loyola University Medical Center in the cardiac catheter lab. Maya was born in 2005. Beata began working for CVS Coram as an in-home infusion nurse, which gave her a little more flexibility in terms of raising a family. And then Kyle was born in 2007. Interesting story there. Kyle was born with thrombocytopenia, which is low blood platelets. And because they needed blood, Beata's blood specifically, but because she had just had a child, she could not give the blood. Beata got up, checked herself out, went to a hospital down the street, gave the blood, collected the blood, came back to the hospital, checked herself back in, and gave the low platelet combating blood to her baby son. The couple moved to Florida in 2014. They already had some family down here. One of Jack's brothers lived here, lived near them. And Jack was able to retire after, I think, 25 years in the fire department. And Beata was able to transfer positions down to CVS Coram. And she developed and had wonderful patients throughout the area here. Jack started applying to become a FEMA representative using his experience as a firefighter. That plan, as we'll see, was interrupted by what happened here. Maya, growing up a typical healthy kid, she had some asthma and allergies, as a lot of children do, but nothing that wasn't controlled with the usual. She enjoyed ballet, gymnastics, figure skating with her mom. It's a very big thing in Poland, figure skating. And so Beata spent a lot of time with Maya towards that. And then Maya and Kyle enjoyed fishing in the backyard. Now, Kyle has majored in being skinny for most of his life. although we're finally seeing him put on a little bit of weight, loves fishing. And the new house in Florida they had over in Stonewalk, is that right? Has a pond out back, which is very handy. Now on July 3rd, 2015, and this is a photo of the July 4th party, Maya started to feel a little bad. She apparently twisted her ankle in a gymnastics accident, or just from doing gymnastics, I guess. And then on the 4th, during all the festivities, Maya simply collapsed on the floor of the kitchen. And I think you'll hear Uncle Bob, her uncle, say she made a noise that no human child should make. And almost immediately had extraordinary pain, which developed over the course of the next 3 or 4 days to the point where it was extremely difficult for her to even walk. This was completely mysterious to everyone. She also had extremely rough coughing fits, which we'll have some, I know we'll have audio of, we have some video of too, so you can see where these came from. These were not, these are from deep within. She was taken to the ER, and then the initial diagnosis was allergic reaction, reactive airway disease. There were multiple theories, but Maya was not getting better. And on July 6th, there was her first inpatient admission to Johns Hopkins. Now, at this point, Maya could barely walk, and she was brought in, testing done. Of course, the parents and her brother are going nuts because they cannot figure out what's going on with her, and she is complaining of being in extreme pain. And so Beata, the nurse, gave a full history of everything she knew at that point, which really wasn't much because it had only been a few days. Johns Hopkins really didn't have much of a diagnosis at that point, although they thought maybe some of the steroids that Maya took from her asthma might have been, causing some reaction. So her first consult with Suzanne Jackman from Johns Hopkins notes low cortisol level, muscle pain, and muscle weakness. Says the pain and weakness may be steroid-induced myopathy. And by this point, Maya, by July 12th, was discharged in a wheelchair. So she came into Johns Hopkins the first time, walking with difficulty, left in a wheelchair. And the diagnoses at that point were secondary to steroid use, generalized muscle weakness, habit, cough. Steroid myopathy is interesting in this case because I think one of the issues may be about the amount of ketamine it all eventually took to control Maya's pain. And something I think you're going to find is that steroids that she takes for her asthma actually have a component that breaks down ketamine pretty readily. We'll get into that a little further and have some experts talking about it. And Maya, like every victim of CRPS, had good days and bad days, but her legs continued to wither. The second admission was July 17th through the 20th, an inpatient admission, again, to Johns Hopkins. There's a history and a physical, presents due to even more increased pain, now moving from her legs to her arms, her back, her stomach, her neck, and head. The differential diagnosis, myopathy, myositis, and now we start in with psychological pain conversion because it cannot figure out why this child has this degree of pain. In other words, no clue at this point. So as part of the treatment, they suggest that Maya be taken somewhere else, TGH, Tampa General Hospital, for therapy. They thought maybe physical therapy would help the child. And as part of that transfer process, they sent Maya's history and physical notes to TGH and then had a phone call informing them that they thought this might be conversion disorder, this might be mental. So the first time any of these other doctors heard anything about Maya Kowalski, it was with an initial possible diagnosis that it was all in her head. The child couldn't walk, and certain symptoms were coming to the forefront by this point. Now, because Johns Hopkins couldn't figure out what the heck was happening, Maya was taken by Jack and Beata back up to Lurie's Children's Hospital in Chicago. Now, this is her former home. It was a familiar place. Lurie's had treated Maya for this asthma previously. They thought, well, let's take him back and get a second opinion. And so, and Johns Hopkins was aware that patients were going to seek a second opinion and contacted and talked to them about their theories. The doctors in Chicago couldn't figure out what was going on either. So Jack and Beata proceeded with Johns Hopkins' recommendation to take him to Tampa General. Again, the doctors in Chicago thought, well, it could be steroid myopathy, it could be generalized muscle weakness, or maybe it's all in her head, but nobody made a diagnosis of that. She went to Tampa General Hospital. And TGH, as I said, already had Johns Hopkins records. Now keep this in mind. Facts will show they already had the records. They already talked to them about what Johns Hopkins thought. All right. So Maya had inpatient comprehensive pediatric rehab and physical therapy and occupational therapy for the steroid myopathy. Now, the reason this is important is that before there are certain treatments that you get for CRPS before you start ramping up on some of the medicines that are used. So you want to see if the most basic
This is why I
types
missed
of
the chat.
therapies can bring somebody around.
This is why you
lower it
had
the
to
point
watch
where
this with me.
it's livable. CRPS never goes away. It is a permanent disease. It's merely controlled. But before you graduate on to more advanced treatments, you want to go through the basics. And fortunately, they had the idea of trying PT and OT, but they did not spot that it was CRPS either. They still went with Johns Hopkins theory, that it was steroid myopathy and that maybe there might be some psychological overlay. Again, they missed it. She was evaluated for adrenal insufficiency, inpatient treatment for mood and disorder. She's given Valium and Prozac. Again, it's a 9-year-old girl, 10-year-old girl. Hospital alluded to Maya or Beata falsifying or exaggerating a fall from her bed and missed several complaints, although they documented several indications of CRPS. However, at that point, she was there for 4 weeks, and as the discharge diagnosis says, history of steroid-induced myopathy, noted as resolved by admission, gait disorder, impaired mobility, ADL, asthma, psychological factor affecting physical condition, conversion disorder versus factitious disorder versus others, anxiety disorder, myalgia. Now, importantly here, you'll see that it says resolved by admission, but we're going to bring in the actual physical therapist that treated her. And you will find throughout this case, the facts will show that there will be a distinct difference between what the actual people who were hands-on treating Maya had to say about how she was doing and whether she's progressing, and what was put down in the medical records. The Tampa General Hospital visit was very difficult for her. At this point, she was displaying what is known as dystonia. Dystonia is where the ligaments in it could be anywhere, but in this case, in her ankles and feet, were contracting to the point where her feet were starting to turn in like this. This is a clear indication of CRPS. Tampa General Hospital thought that maybe they should put some boots on her and see if that would correct her feet turning in. And we'll have some video from the physical therapist that shows Maya attempting to walk in those boots, Maya attempting over and over again with things like trying to push her leg and saying, giddy up, horsey. Again, remember, it's a 9-year-old girl. And demonstrating she was trying as hard as she could to walk. The evidence will show throughout this, Maya did not want to be in a wheelchair. She did not want to be one of the kids that was looking out the window while all the other kids were playing. But Maya kept getting worse, not better. And she was still in pain. And when school starts in 2017, 15, she said she was still in pain throughout her body, and she would moan and scream in time and panic. And she kept getting weaker, and weaker. Now, Maya was in and out of Johns Hopkins throughout this period of time. Okay? And there was prescriptions for opioids, again, physical therapy, occupational therapy. Nothing was working. No one had any answers. And then a patient of Beata's, one of the infusion nurse patients, said, this may be CRPS. I have a daughter with it, I believe. Why don't you look into seeing this? And there are doctors here in Tampa Bay area that are specialists in this. And so she went to see Dr. Anthony Kirkpatrick at the RSD Foundation, Reflex Sympathetic Dystrophy Foundation. Now, to diagnose complex regional pain syndrome, the Budapest criteria for CRPS gives us certain specific symptoms, diagnostic criteria. Persistent burning in the arms, hands, legs, feet, or another part of the body, check. Multiple medical records will show she had that. Pain can be mild or severe. We have actual audio recordings of Maya moaning. You'll see and hear the child and can determine whether or not she was in pain. Swelling, sweating, all of those. Dramatic changes in skin color and skin temperature. Testimony is that Maya was constantly too hot or too cold. Now, people get too hot and too cold all the time, but usually they're not 9 or 10-year-old children, to the point where they're either shivering and need a blanket, and then 2 hours later are wondering, why is it so hot in here? That kind of temperature change. And of course, then blurred vision, which is already appearing in the records, dystonia, again, the movement disorder like this, and then a really confusing symptom called allodynia, which is extreme but often inexplicable sensitivity to touch. It means that on some occasions, you can come up and squeeze Maya's arm or touch her legs and get no reaction at all. And at other times, just the thought of someone coming up to her and putting their hand near her as though they were going to touch her would give off an incredible reaction, screaming, yelling, resistance to anyone even touching her. Reason? That because of the RSD, CRPS, she would feel extraordinary pain as a result. But it doesn't happen all the time, and it doesn't mean that when you don't have it, you're not in pain. One of the experts will testify that this is sort of like, think about it as a cancer patient or someone with an intermittent disease. You may be in remission and be doing fine and look fine to everybody outside. You may be hurting like crazy on the inside, but outside you look pretty good. And then other times you may be curled up in a fetal position and not be able to walk, talk, or move. Also a light sensitivity. Interestingly, the Budapest criteria, which are kind of the accepted criteria for CRPS, are also listed by Johns Hopkins as their diagnostic criteria for CRPS, right? So she goes and sees Anthony Kirkpatrick, Dr. Kirkpatrick, who you'll meet. Now, notice on the photograph, see the feet there turned in? Notice the lack of muscle mass on the legs. She's in a wheelchair, obviously, and that's sort of a attempted smile, but she's got sunglasses on. Now, why is a child wearing sunglasses inside at the doctor's office? Because she has a sensitivity to light caused by the CRPS. So Dr. Kirkpatrick went over the entire full history, list of symptoms and therapies tried. He did objective testing, including pain threshold tests, range of motion tests. We'll actually have the videos from before and after, where you can see that before the treatments she eventually had, a part of the issues in this case, she could barely get her arm up to here. And then you'll see after the therapies that they ultimately complained about, that she can put her hand completely over the other side. And the diagnosis was CRPS. Now, Dr. Kirkpatrick did not say, all right, let's just go into some heavy duty pain meds or anything else. Again, he said, let's try some physical therapy and what's known as warm water therapy, which is essentially where you use a very warm pool or bath or something, and you do it in there to loosen up the muscles. A little different, but again, physical therapy. He did not recommend out of the box any sort of pain meds. That didn't work. And that's when he introduced them to a revolutionary use of an old drug called ketamine, and the ability to break the chain. See, CRPS involves a problem in the pathways between the pain sensors in different parts of the body and the brain. Usually when someone injures themselves, you sprain a finger or something, out, it hurts like heck. But over time, right, it starts hurting less and less and less. And pretty soon after a while, you just kind of forget about it. That doesn't happen with CRPS. Because of a problem as yet not understood, which is why we don't have a cure, the pain relay, the circle, the loop here of feedback is getting bigger and bigger and bigger until what was once a tiny little fracture or a tiny little sprain or whatever you want to call it turns into something that is the worst pain known to medical science. I'll talk about that in a moment. And ketamine, which has been around since the 1950s, it's FDA approved. It's used mostly as an anesthetic. And it's not an opioid. It doesn't work like an opioid. But for some reason, not fully understood, it breaks this feedback loop, and people start getting better. Not all of them, but a very high percentage get better. So there's actually, I think, do we have the audio on this? So this is one of the initial visits with Dr. Kirkpatrick discussing the use of the ketamine infusions. And I want you to concentrate on what this mom, who's also a nurse, is asking about.
Who in your practice administers the ketamine?
I do.
You do. Okay.
And I'm ACLS certified also. I have to be.
Yeah, you have to be.
Well, PALS, you got to have
Mhm.
PALS and all that stuff. And we have a pediatric code card back there. You know, we have to do all that stuff if we're going to do
Good.
children.
Absolutely.
Yeah.
That was my next
They're-
question.
they're
Do you have a
fine.
pediatric crash card?
No, we have to. We have to.
Yeah.
You know, I mean, that's a standard care. You know?
Mhm.
Now, Beata knew all about how to keep her daughter healthy, not this disease, but how to keep her daughter healthy and how to protect her daughter. And notice in there, one of the first things she asked about, is there an ACLS crash heart? Are all the different equipments that you might need, even during an infusion, because remember, she's an infusion nurse, in case anything could go wrong. Now, here's the McDill McGill, excuse me, pain scale. This is interesting. I had no idea until I reviewed this. But I'm sorry. This right here, as you can see, this goes over, and this was developed in Australia. It's been around for a long, long time. It's adopted by about every hospital, every medical association. And this describes the different pain levels according to description by patients and every other objective finding that one can make. And you'll see at the top that CRPS is the most painful. It was actually developed at the University of Montreal, Canada by Dr. Lasco, I guess. And most of the clinical trials were, I believe, in Australia. Symptoms of CRPS, we've gone over those. It strikes mostly females in the population between the ages of 7 and 21. It is known for initial symptoms that are inexplicable. However, upon close review and a differential diagnosis to rule out other things and consider neurological disorders, this is one of them. And if you can identify a few of these symptoms, our experts will say CRPS should have been brought into the mix very quickly. That did not happen here. All right, so from October 6th through 8th, she has her first ketamine infusion with Dr. Kirkpatrick, a follow-up, and the first infusion went well and helped to get Maya out of pain, and there was a lot of encouragement over that. He wasn't pushing for more ketamine. He's simply trying to instruct on a conservative approach, warm water therapy. Let's try the ketamine again. They tried it again, and again, got some good relief, but not for very long. Maybe for a week, 10 days, but not what they were looking for to bring this child back in a normal kid, right? So at this point, Dr. Kirkpatrick says, well, she might need more and frequent of these infusions. So why don't you go over to Johns Hopkins and visit for a PICC line placement? And so on November 4th, she goes back to Johns Hopkins for a PICC line placement. And the diagnosis over there accepted is CRPS. And so Johns Hopkins itself does the PICC line. PICC line is basically a tube that's put in so you can do the infusions a lot easier without trying to find a vein. All right, so, and she begins therapy because, again, everybody wants to find out, is this really anything exaggerated by Maya? Is there a psychological component to this? Let's just make sure. So Maya starts with a therapist by the name of Rebecca Johnson, and I believe you'll hear from Ms. Johnson or Michelle Rogers, who is her partner there, about those. Maya was never determined to have any type of conversion disorder or factitious disorder by any psychiatrist or psychologist, except that as part of CRPS, there can be certain symptoms of conversion, which is, how do you explain this? The feelings of pain become so exaggerated, this allodynia, that the patient is anticipating pain before it actually happens. So she goes and has the therapy, but still nothing is working and nothing is really getting her out of the extreme pain on a long-term basis. So Dr. Kirkpatrick, and you'll hear from Dr. Kirkpatrick here to explain all of this. Unfortunately, in the United States, the procedure that had been shown to work the best for intractable CRPS, long-term ketamine infusion under general anesthesia, a medical coma for 3, 4, 5 days, is not performed in the United States. It's performed in Germany. It's performed in Mexico. It had been around since approximately the 1990s. It had essentially 100% rate of safety, that is, no one had ever died from it, and it had a very high rate of success.
Let me just say, I am not convinced that America has a decent healthcare system. When you hear that these therapies are available in other countries, where they can get someone out of this type of terrible pain, and yet we don't do that here. I hate going to the hospital now. If you're just joining us, we are watching the Take Care of Maya opening statements trial that started today. We are watching it at a little bit higher rate of speed. If you're wondering why sometimes it sounds like he's talking really fast when he's listing things, it's because we're at 1.25, trying to get through as much of this as we can before I have to go off to work. But this is, it just bothers me. That our system, that we've been told, brainwashed from the time we were little, that this is the greatest country in the world and that we have everything available to us here that we could ever possibly want. And the older I get and the more I learn, the more I realize that that is not true. We may have the most freedom here still. Hard to believe, I know, but compared to other places in the world, we do have more freedom than most. But we do not have a good healthcare system, and it is very dangerous to go to the hospital these days. I avoid it like the plague. Uh, it's a scary thing, especially taking your children to the hospital, because this kind of thing can happen and has happened to so many people that I know personally, that whose stories I have covered. And our healthcare system is abhorrent. Thank you, Femnital. That is a perfect word to describe it. And it's filled with people who are so full of themselves and their own importance and their own wisdom and their own knowledge, that they can treat a parent in this disgusting manner. A parent who's trying to advocate for their sick child. Nobody loves or cares for your child the way that you do. Not a doctor, not a teacher, nobody. And these people have become so puffed up with their own importance and their own power. They need to be taken down a notch or two, several notches, and put in their place. Doctors are not in charge of my children. And this is a real societal problem we have in this country, where people in authority think that they know better than you and that they can take over the raising of your child. That's what this case is about. Octavia, you're a little bit late. That's okay. You can catch up by watching the replay later. We've only been here for 51 minutes at this point. I know the judge really needs to just shave that. And what is he doing? What are you doing? It's time to move on and accept your baldness, sir. Like that little tuft of hair. It's not fooling anybody. It's just distracting us, really. I mean, just be bald, Power to the people. All right, here we go.
There is a physician, a University of Texas trained anesthesiologist, Dr. Fernando Cantu, who's going to fly here from Mexico to describe the process. And it involves, again, infusions of ketamine over a very long period of time. The idea being that it causes the brain to reset so that you don't have this feedback loop causing the pain. The first one in late November, 19th through the 23rd, there is a high dose infusion. And what do you know? The lesions begin to heal. And there's a slight less turning out of the feet. And yet the pain was still not where they wanted it. So Maya stayed there, and then on November 19th through the 23rd, she went through another high-dose ketamine infusion. Now, during this period of time, other than during the middle of the infusion process, there were absolutely no negative signs from Maya. She had a brief increase in her liver function results, but only we're talking for a matter of hours. And as soon as the ketamine infusion was done, they went right back. And it's important to note that other than at that time and through all of her ketamine treatments, Maya's liver functions, which is the things you look at if you've got a medication like this and you want to see, is it hurting somebody? You look at the liver functions, and her liver functions have stayed normal throughout. And you'll see the medical records to show that. All right. So then a miracle. By December 28th, Maya's lesions are noticeably less. Her feet are starting to not be as turned out. In fact, by the end of January, and we'll show you the films, she's actually able to get back in the pool. You can see a picture of her here in, I believe, late January. And this is her. You'll notice the feet looking better. She's on Kyle's shoulders there. You'll notice a real smile coming up. She's able to do her warm water therapy. But she still is having some pain. And the idea here was to get this kid out of the wheelchair, right? They wanted to get her out of the wheelchair. And to get her out of the wheelchair, they really needed to get the feet totally back, and they needed to get the pain levels back so it wasn't so painful when she walked, so she could build up her legs. That was the idea. So they go back to Johns Hopkins, okay? All right. Central port means there's an operation, and there's the note. Placement implanted central venous port. That's a tube under her arm to allow her to continue high-level fusion. Not like Mexico, but outpatient procedures. And she has a number of them through the course of the next 9 months. Through the course of this, and with a doctor named Dr. Hannah, who Dr. Kirkpatrick recommended, Dr. Cantu recommended, because frankly, ketamine is incredibly expensive and it's not covered by health insurance. So Dr. Hannah was set up to do these on a regular basis. Oh, yeah. Oh, I better get going. Okay, so Maya goes back to Johns Hopkins, and Dr. Anthony Kreisman, who had seen her before, a long-term ketamine infusion, quote, ketamine coma. And they commented on how withdrawn and how much pain she's in.
I'm gonna have to
Listen what he
slow
says
him
on
down
May
because he's
11th,
hurrying.
After about 30 of these infusions and the long-term infusion, she is a completely different child from when last examined. By that, I mean she is not in any pain. She is not moaning. She is smiling and interactive. She is very engaged. She moves spontaneously in her wheelchair without incurring pain. Through the course of that summer, because the ketamine is so expensive, they tried 2 other therapies. One's known as hyperbaric. You can see it right here, extreme high oxygen content, which has been known to help some CRPS patients. She also tries the IVIG treatment to increase her immune system because it's believed that CRPS can be, the immune system may be part of CRPS. And by the end of the summer, she is almost back on her feet. This is in 2016, around August of 2016. Maya is almost back on her feet. We have video of her actually using that as kind of a jungle gym to try to strengthen up her arms and her legs. Everyone is very excited. Everybody is looking forward to Maya getting on her feet. And then she has what they hope to be a minor relapse that turns into a fairly major relapse. And on top, she goes back and has larger ketamine doses with Dr. Hannah on October 5 and 6. And she has some gastrointestinal problems and a lot of pain in the midsection. There are stories that you will hear about her screaming at night. She could not take the pain in her stomach anymore. At one point, the screaming was so intense that the family got walkie-talkies, so the family could stay all the way over on this side of the house and Maya over here because no one could sleep. So they communicated by walkie-talkie. All right, so they decided on the 7th, October 7th, a key date, to take her to Johns Hopkins ER. Now, the reason was that we had Hurricane Matthew tracking up. If you've been in Florida long enough, the hurricanes start to blur together. I believe it's Hurricane Matthew tracking up the eastern seaboard here, getting winds like, 35 to 50 miles an hour. To people from Florida, it's like, wake us up when it's a Cat 4. And, but to, the Kowalskis were from Chicago and had never experienced this before. They had visions of like the movie Twister going around in their head. And so all of the ERs and everything were closed. So they took her up to St. Pete to the ER. And Maya is seen by 5 different doctors and groups of nurses and social workers from the ER. And she comes in about 8:46 in the morning and she's crying and screaming and she's in a fetal position, clutching her stomach, and she is just out of her mind. And the ER doctors there start to react rather negatively to this. Beata comes in approximately 2 to 3 hours later and once again goes through the history, which Jack has been trying to relate, of all of the different visits to Johns Hopkins and all the different treatments and how everything has failed. And the only thing that has worked has been the long-term ketamine infusions. And we can try this. Can we try that? Can we try a pump? Can we try, what can we do to get our daughter out of pain? For some reason, the doctors there either review all the past records and the some 7 to 8 to 9 prior visits, and the fact that she's had surgery there to have a port implanted to help her with the ketamine infusion. But for some reason, they decide that that isn't it at all. She really doesn't have CRPS, that the mom must be making all of this up, that this is, as a nurse who we think is the one who actually made this diagnosis, Munchausen by proxy, textbook Munchausen by proxy. Now imagine this is an ER, the child's back there, the parents pulling their hair out, trying to explain to the hospital, this is what Jack will testify to, and Beata is trying to explain to them in the ER where they've been about 5 times before, exactly all the history that's going back, that's already in their records, including records from the other hospital. Everything's there. For some reason, the doctors, nurses, and social workers ignore all of that and decide this is not CRPS, that this is the child who's making it up and the parents are making it up. And then this must be child abuse by the parents. Now, the court has told you that there's pretty much a hair trigger on suspicions, and so they make the call, and that's not part of this case. You're supposed to make the call. Slightest different suspicion, you're supposed to make the call. So that's not a bad thing, whether it was right or not.
Stupid. It is a bad thing. It's a stupid and bad thing on the slightest thing. Come on.
After that, and the failure to diagnose.
You make that call,
previously,
and CPS ruins your
so
life.
that none has ever happened. Maya, they try to take Maya home after the first night. They're told that they need to observe the child overnight. Fine. But by the second day, Maya is still in pain. They do knock her out with a lot of drugs to get rid of the initial pain. And they give her ketamine. So the next day, she's much calmer. And so then they decide that Maya cannot go home. They decide that taking her home is AMA, against medical advice. And they say, if you try to take your daughter home, we're calling security. So the Kowalskis don't have much choice. They end up leaving. And the next thing they know, they're off to the races and Maya is an unbelievable journey up through and including the death of Beata. Now, what you'll notice in the records, again, the records paint a glowing report of Maya. Just how great she's doing, how much she enjoys things. What a great stay she's having. She's getting this, she's getting that. The only thing she was getting to do was play the piano. Maya knows how to play the piano. She got to play the piano, and she got to draw pictures. Every once in a while, she could send a letter. If she wanted to talk to her mom, it had to be on a supervised call. She could only see her dad and her brother on pre-arranged and monitored situations. If she wanted to see, they hired an attorney, obviously. If she wanted to see her attorney, the nurses would demand that the door stay open. She never had a private moment with an attorney.
They should be arrested. This is a crime.
And have a very close relationship with the priest. So the priest went in to see Maya, and he will testify that when he arrived, he was told that he could not see Maya, and that she had had her religious artifacts taken away. We have a photograph of it. And he asked about this, and they said it's because we believe her mom is controlling her through religion. And so he was not allowed to see her that day. And it took a few other attempts. And then finally he was allowed in, but he was told no religious procedures. You come say hello, no religious procedures. I told you already about the 42 hours of being placed in a darkened room and told this is a new type of EEG, Maya. We're gonna really figure this out if this is in your mind or not. No, it wasn't. It was the surveillance room. And again, the goal, because these doctors had somehow gotten confused to think that CRPS includes paralysis. Paralysis is not part of CRPS at all. And yet they were trying to prove that Maya could actually get out of bed, that she was faking it, that she was sitting in that wheelchair all the time.
They don't even know what the disease does.
I don't know what reason, but she was faking.
Be very afraid.
Actually, when nobody was watching, Maya was getting up out of that chair and walking around everywhere. So they put the commode just a little bit out of reach, right? Figuring when she thinks nobody's watching, she'd get up, she had to go to the bathroom, go over there. Well, that didn't happen. And you'll see video of Maya having to be carried over to the commode. Of course, her skin started to show the lesions again. Maya started on a dive. Badly, badly getting worse. Depressed. The lesions are forming. You'll see them. Yeah, here, now they just may look like scratches here, but you can't see too much of the stuff on the back. What you'll notice through the series of photographs, and thank goodness Dad here took photographs of Maya's lesions, and you'll see those photographs, and I want you to compare them to the medical records, because you'll see on the dermatological reports, you'll see skin normal, and yet you'll have photographs from that day showing lesions. On January 6th, they decided that they needed photographs to prove that Maya really didn't have as many lesions as they said.
Maya was
So
9. She was 9 when this was going on. I just want to take a minute to also say this is an uphill battle. This case against a negligence case against a hospital is an uphill battle. They are going to throw everything they can at them. You will recall perhaps another case that I covered, the Pelletieri case. Justina Pelletieri was another child who was medically kidnapped by the Boston Children's Hospital, and her family sued. I have a great interview with her dad somewhere on YouTube. It's on my channel. Just look up, if you want to search it, type in Pelletieri, you'll probably find it. And it's next to impossible. In the Boston Children's Hospital had so many connections to big government in Boston and the courts. That case was literally thrown out of court. That judge, it was the court system that did it to her too, because there was a judge involved who kept Justina a prisoner in the hospital for 15 months, kept her away from her family, said that she had a psychological disorder. And it wasn't. It was a rare disorder. God help you if you have a child with a rare disorder, because no one in the medical community will believe you. Only like one doctor, and then no one will listen to him. And the people who think they know better, these child abuse doctors, they will take over and they will torture your child. They did it to Justina Pelletieri. A judge had to admit, finally, that they had done this illegally and wrong, and released her back to the custody of her parents. But when her parents went to sue Boston Children's Hospital, it got thrown out of court. They never had their day in court. So the fact that this is even going to trial is kind of amazing. Let's hope that in the middle of it, it doesn't get thrown out for some bullshit reason. And that bullshit reason would be that these big children's hospitals like Johns Hopkins and Boston and the one in Arizona that's so bad, they're all connected to politicians and judges. And I'm telling you, it's bad. The corruption is bad. I was told that these medical malpractice cases are damn near impossible to get. Impossible. You cannot get justice against a big time hospital. So good luck. Yeah, this trial does need to blow up. This trial, this whole story encompasses the last 20 years of my reporting. All right, calm down, everybody. I lost power here for a second. I got it. It's always at the worst moments, isn't it? Let's get this going back up here. Thanks for waiting around. There's not even a storm going on. So what is it? I don't want to be conspiratorial or anything, but just as we were talking about why this trial needs to go viral and the corruption that is involved, suddenly my computer just turns off. Just turned off. Just turned off. Am I back on all channels? Let's see. It looks like it. Rumble, locals, checking in on you. I don't even have you open yet, so I got to reopen all my windows because my computer just literally just shut off. I've never seen that happen before. And I didn't lose power. Like, I didn't lose my lights. So it wasn't the power. It was just my computer just shut off for no reason. So I had to get it turned back on and reboot, but maybe that'll keep my camera working a little bit better now. Sorry, we're going to get this back up and working here. I just need to open up locals and Rumble and get my screens back here working. So it's just funny how this happens to me, huh? Right? It overheated. I don't think so. Like my laptop is sitting on my desk where it normally is. Yeah, we interrupt this program to bring you an important message from Johns Hopkins. We are not corrupt. Your computer has been restarted because of a problem. Click report to send more detailed information. Sure, I'll do that. Yep, okay. Tell me why that happened, Apple, because that sucked. All right, hold on. I'm opening up locals so I can get back into the chat. Hey, guys, sorry about that. Yeah, I'm back. I'm back. All right, I got to open up Rumble now. Check on my Rumble peeps. How you doing, Rumble? Doing all right? Did you do all right without me? Did you go get a cup of coffee? Do some squats while I was gone? It's time for squats. Hey, guys, I'm back. Hey, Rumble. All right. All right, let's... Oh, don't start dogging my Mac. I love Apple. I love Macs. All right, hold on. I got to bring up the trial stream. And right in the middle of a good rant, too. Now I lost my train of thought. Lars, you're saying the only way a computer can turn off by itself is if it overheats? Well, why wouldn't it tell me that? It's not that hot. It's really not. It's warm. It's not that hot. All right, let's go. Let's go. Let's get this going. Where's my history? Hey, at least my camera's not freezing at the moment. Apple is not horrible. Stop saying those things. Lars, it can't tell you anything if the CPU is melting. Women. Stop making me laugh. I can't laugh when I have this cough because it just makes me cough more. Quit making me laugh. All right, I'm bringing the trial back up. Here we go. All right, so I think the point that I was making before I got so rudely cut off is that these hospitals are hardly ever held accountable. And so if this works for them, it will be a huge day, a huge win for medical kidnappings. All right, let's continue.
Let's talk just briefly about Beata. During this period of time, Beata is only allowed to talk to her daughter. Hopefully we'll be able to play some of the tapes where you'll be able to hear Beata trying to talk to her daughter, but they put certain things off limits, like, how are you doing? How is your treatment? How is your medication? Things like that. No, you can't talk about that. Not allowed to talk about that. They're the most mundane things you can imagine on these telephone calls. We are allowed to use them. And in those, you'll hear one of the social workers, Kathy Beatty, who was assigned Maya. Now, she was a social worker from one floor, but wherever Maya went, Kathy Beatty followed. And we have the trail of emails and notes leading from notification to the general counsel through risk management on down to one of the senior doctors, down to Beatty about doing this stuff, including what you just saw there in the photograph. We'll prove they knew it at the highest levels. Beata is going freaking nuts, the evidence will show. They find out that Beatty's had some disciplinary problems. They find out, kind of through the grapevine, how bad things are for Maya. They
Of
find
course.
out about the lesions. Now her feet are completely turned in. And Maya has become so weak, the CRPS has developed to the point where she can't sit up straight. Okay?
The CPS worker always has disciplinary issues in their background,
Yeah.
by the way, and they never fucking discipline them, ever.
On the evening of January 7th, Beata, they were going to a party. Jack and Kyle were going to a birthday party, I think. And Beata had been not acting herself at all for a number of days. And she didn't want to go to the birthday party. She didn't really want to go anywhere for a long time. The only thing she did was go to work. She was withdrawn. She and Jack had been having screaming fights because Jack did not want her to be so absorbed in this. He was more of the, let's just try to get her out of there, work her out. And Beata was trying everything, legal, social, every possible way to get her child out, and her child was not coming out. And she found out through several sources.
Yeah, this drives
the
women
condition
crazy.
that Maya was in and what was happening to Maya.
It drives them
And
absolutely
on
out
that
of their
evening,
minds.
Once they were out, she decided to take.
Why do you think Cynthia Absug believed a group of con men who told her that they were with the military Pentagon and they were going to rescue her son? Why do you think she believed them? She believed them because this process drives mothers, especially, out of their minds. Because I don't think people understand. I'm not saying that losing a child to CPS or a hospital that's keeping your child doesn't affect a man in a horrible way. But men are notoriously more stoic about these things. Women become desperate. They become, it is the only thing they can think about. That bond between you and your child has been broken unfairly, unconstitutionally by these evil people. And all you can think about is getting that child back. That's all you can think about is getting that child back. And this is what it does to women. It drives them insane. And so they make decisions that they would never normally make. Like what Cynthia Absug did when she believed this group of con men. She didn't think they were con men. She believed them because she was in a state of insanity. They had driven her crazy. The hospital had driven her crazy. The doctors drove her crazy. The CPS drove her crazy because they stole her son. And when they steal your child, when they can legally kidnap your child, it drives you crazy. So yeah, I know exactly what this man is talking about. I know exactly what her mother went through because I went through it every step of the way with Cynthia. Rachel Bruno is lucky she didn't lose her mind too. She had to move out of her house. I mean, what they do to people in these situations it should be criminal. What they do to mothers, it makes me sick.
Some belts and put them together, go out to the garage, make a noose, put a stand below her feet to be able to reach it. She took an IV.
Oh, look at her face.
Of saline solution and put the IV in her arm.
Aww.
And left a cell phone with a note that said retribution, retaliation, out. And she left 2 suicide notes, which we'll try to bring before you, telling you about why she did it.
Oh, God. Oh, God.
It took probably about 22 minutes, according to
this poor
pathologists,
child.
to strangle to death. She'd kicked the stand out from under her. When Jack and Kyle got home, they thought that she was sleeping in another room, which they did a lot, because they weren't getting along, frankly. And so nobody did that. And then Beata's brother was coming in that night. He came in and just went to sleep. Got up the next morning, walked out into the garage, I guess looking for something.
Let us also let me cut in here because somebody just said, and yet they leave children with abusive parents. Remember True Crime Tuesday last week? Remember what we talked about with the Mormon cult abuse case? Influencer, what's her name? Ruby Frankie. There were like 12 different times when CPS was called on that family and nothing was done. And those kids were not taken. And where were they? They were strapped in a basement with deep wounds in their wrists and ankles from being tied. And they were starved. And nobody helped those kids from CPS. What the hell is good is CPS anyway? If they cannot even get that right, and yet they take children like this from perfectly good parents. It's a disgusting system, and it's a broken system, and I can't believe that this family isn't suing CPS on top of the hospital. Yes, CPS is absolutely useless, an accessory to kidnapping, yes, in many, many cases. It's disgusting. And so this situation now has driven this woman, her mother, this child's mother, Maya, to suicide. And now the family gets to find her hanging.
And at first he thought it was a Halloween costume or something. Then he looks closer and it's his sister. And he, of course, just completely screams out. Jack comes in, sees his wife with Kyle right behind him. Kyle was, I don't know, we'll ask him how much he was able to see. 911 call made. You'll hear that. And Beata is taken down. We'll have some, we're not going to get gross on them. I'm not going to try to upset you too much on the photos, but we will show you some of the photos, right? Okay. Now, after that, Jack says, let my daughter go. If Beata is the big reason here, if she's the Munchausen by proxy, why keep Maya? No. It takes another week and a half, and Maya, let me get this straight. Maya's actually told in the hospital that her mom's dead. Johns Hopkins believes it's still in her head. And there's a text that goes around about how Maya's now better off because her mom's dead. Between two of the doctors.
Oh my God. Shameless.
Finally, after a lot of effort, Maya gets to go home. Now, I'm not sure if I got the photograph on this, but I'll show you a photograph. You can see on the ride home, she's got stuffed animals underneath her, and she's slumped over like this because she's so weak she can't keep herself up. Through the course, then, okay. All right. So the hospital will now come in and tell you just how great their therapies were. We'll show you the records, and they were not doing any therapies with Maya. They were warehousing the child. Maya gets home, and with her parents' care, and one other thing, the hospital doesn't want any more use of ketamine ever again. And we'll get into the details of that. So just using the old, regular, and largely ineffective pain meds, this child manages through warm water therapy and being home with support and love about 8 months to get out of the wheelchair. Now, folks, I want you to compare that to the time after they first learned about how to use the ketamine, how fast it took to get her ready to roll, right? Out of pain. This child does it in extreme pain. So she's on crutches here about the spring of August of 2017. Yeah, August of 2017. And it takes another year until Maya can walk unassisted. She's on crutches. One tough cookie, and we'll talk about just how tough she really is to be able to go through all this. Things go well for another couple of years, but in 2020, she has another bit of bad news about her schooling and has yet another relapse. This time, again, similar to the one in 2016, and similar, it was an emotional issue. The one right before she went into Johns Hopkins, all the bad stuff happened. Pretty much the same type of symptoms, and she ends up back in the hospital, and she has to be put on a feeding tube because she's in so much pain she can't feed herself. So fortunately, after about a week and a half there, she was able to get well enough to come out and proceed on her way. And again, had to start over in some ways, and was able to rejoin a lot of her life. Without her mother, Jack lost a wife, Kyle lost a mother, and the effects on the family are, well, you'll just have to listen to hear. Okay? So we're asking for damages for the physical injury, the overwhelming pain, not simply the ketamine alone, but from the aggravation of the ketamine. Let me talk about this. Now, the CRPS started before Johns Hopkins ever got finished, okay? But the evidence from every doctor that's a specialist in it will tell you that it is vitally important during the first episode of CRPS that you properly manage it in order to prevent an aggravation of the disease to the point where it's going to reappear, and you will have longer, more frequent, and more devastating episodes down the road. The ketamine's nickname is the suicide disease. So the law is then that if you take a symptom, an illness or an injury, and you aggravate it to the point where that person has a lot more pain, a lot more trouble with it, that unless some doctor can come in and identify the percentages back and forth, they're on the hook for the whole thing. All the ramifications. So now we've got long-term effects, and we're going to give you mortality tables so you'll be able to know how many years out. I'll give you some formulas on how to try to do this. I'm just an advisor. You ultimately will make all the decisions here, right? But I'll try to help with some formulas of how you can calculate such things. It's a difficult job. We talked about this in voir dire, right? All right. So we'll talk about each and every one of these. We'll talk about the physical injuries. We'll talk about, and Jack has, I haven't spent any time on Jack, but we'll get into that again on the testimony. Suffice to say, it's been devastating to not have his wife and the mother of his children. Kyle's lost a mom and the effects on him. So we'll talk about the pain and suffering, the mental anguish that you will carry around, they will carry around from not having a mother and knowing your mother killed herself for you. We'll have inconvenience. Now, you know, Beata was a nurse, so she could take care of herself and she could take care of her family. She's not around. Loss of capacity to enjoy life. There's this thing called alhedonia, which means that you lose the ability to have pleasure out of things that once gave you pleasure. Maya tried figure skating. She won't do that anymore. Maya's not going back to gymnastics. Maya doesn't want to play piano anymore. The family doesn't want to go back to the church. And the family is having an extremely difficult time staying in the house, obviously. There's diminished earning capacity because what happens on your job if every, year or two or every 6 months, you have this debilitating episode where you can't work and you can't explain how long it's going to be and whether you're going to be able to do anything at home or not. And like I talked about, the aggravation of the pre-existing symptoms and the illness. So then we ask you to consider punitive damages. Our argument is this, that these actions are so completely and utterly
I'm going to have to go really soon because I have to, I've got to get ready and get to work. So I've only got 15 minutes to get ready and I'm not even dressed. And get out of the house to get to work on time. So we're going to go, I'm going to see if he's going to wrap up right now. And if not, this will go into part 2 tomorrow morning.
It's designed to deter, not only here, but in the future. And it's designed to punish, right? And so your decision there would be predicated on how much money does it take if we got to that point. What alters behavior of companies like that? So that's your job, is to figure a little bit out about this, a lot about this. And so I was trying to figure out where the defense is going on this. I think it is that from their doctor's point of view.
All right, we're going to have to catch up with this later. Hangry Fox just got home and he had a rough day at school. So I need to go talk to him before I head off to work. So guys, it's been a pleasure seeing you today. We're going to do part 2 of this tomorrow. I cannot stay right now, unfortunately. So we're going to have to pick this up tomorrow. For part 2, we will finish up with the opening statements. We'll get to the defense statements as well. And yeah, I got to go help the little one. So I'm going to go do that. And you guys take care and I'll see you tomorrow. All right. Don't forget to follow me on Locals, meganfox.locals.com. And that you'll get all the, turn on your notifications so you know when I'm going live. I don't know what time I'm going to do it tomorrow. It's just going to have to roll with my schedule. Okay. I'll see you later. Bye, everybody.